aceticum acidum. It has another name is called glacial acetic acid and its formula is C4H3O3 as a whole. Now first we are going to study about the constitutions, then physical general. It do not have much about a mental general. As we all know, there are two kind of case usually comes to us, and that is chronic disease and the acute disease, or also we can say as chronic case and acute case. Okay. Now, how do we distinguish which case is what? What is chronic cases and what is acute cases? Our master Hahnemann in Organon of Medicine, it has clearly distinguished that what is acute and what is chronic disease. In case of chronic disease, the patient will often say the onset is very gradual. That means or imperceptible. That means gradual or imperceptible. That means it when did it start? We cannot properly say or tell. The onset is very gradual. Okay. And in case of acute disease, it has sudden onset. Sudden onset. That means how this disease started, it can easily be remembered. Maybe it is of 3 months or a few weeks ago. But in case of chronic disease, it had started 2 to 3 years ago, but clearly I do not remember. This is number one. And number two, in case of chronic disease, the progress is very slow of the disease, and because of which later on it makes the patient life threatening. And in case of acute disease, it onset is sudden, and either it kills the patient with its sudden onset and vigorous condition, or otherwise it left the patient as he or she was earlier. So based on these symptoms, we have to distinguish from acute disease and chronic disease. Now there is other kind of symptoms. Let's assume a patient came with an acute symptoms and you give medicine, the patient gets palliated. After a few months or few weeks, the patient came again with the same symptoms and you give medicine and it goes away. And after a few weeks or months, this comes again. So that means that there is a certain kind of symptoms which comes after a few certain interval, and that is also indicates there is a chronic disease. Now, according to homeopathy, chronic disease is due to chronic miasms, and miasm means we already know the constitutional pollutions. That means there is something inside of his body which is preventing the disease completely or pacing the disease gradually and making the life of the person is threatening. So that means chronic disease needs a different format of case taking, that is called chronic case taking, and acute disease need an acute case taking. They both need a different type of attentions of the physicians. In case of chronic disease, we have to implement our medicines based on the fundamental symptoms of our drugs. That means in chronic cases, we must understood the constitutions of the medicine, the physical and mental makeup, the generals of the medicines. The general symptoms hold the key importance in case of chronic diseases, whereas the particular symptoms hold the much importance. That is mostly the complete symptoms. Complete symptoms we also know the complete symptoms as which holds location, sensation, modalities, and concomitants. Now, concomitants are very tough to get, but location, sensation, and mostly the modalities are very easy to get, and these are the key of any particular symptoms or any acute diseases. Now, when we are going to study about any drugs, we have to understand the fundamentals of that medicine because that will be very important when we are going to prescribe it for a chronic case. And in case of acute, we have to remember most of the symptoms completely, and that is the particular symptoms. Now, try to focus on the aceticum acidum. Okay, first see the constitution. The constitution says adapted to pale, lean person with lax, flabby muscles, face pale, waxy, in bracket firm. And second point says marasmus and other wasting diseases of children in bracket abrotanum, iodum, sanicula, and tuberculinum. So that means a patient of acetic acid is mostly having any kind of wasting disease. It may be protein energy malnutrition, it may be marasmus, it may be cancers, it may be due to after any injury, any kind of prostrations or hemorrhages. These are the wasting disease where patients are facing difficulties in building the muscle mass. And because of that, losing proteins or wasting diseases, the muscles are flabby and lax. The patient is lean. There is paleness over his face and body's waxy face. These are the typical symptoms of any prostrated or wasting disease continued in a patient. Next, come to the physical general symptoms. See, first is hemorrhage. That means bleeding from every mucus outlet. Not necessarily a patient coming with bleeding from every outlet. It may be a single outlet also. It may be nose, throats, or lungs, stomachs, or bowels, uterus, anything. Any outlet there is a disease, there is bleeding, and that is known as hemorrhagic. Continuous, the underlying pathology or cause may be any. We have to focus on the symptoms. Ferrum and millefolium, ferramate and millefolium are good for uterine or bowels bleeding. We also know that in case of millefolium or in case of hamamelis, it is good for rectal bleeding. Okay, metrorrhagia. Metrorrhagia means bleeding in between the periods, or it may be irregular periods, or it may be irregular pervaginal bleeding due to any underlying female genitalia pathology. Second is vicarious. Vicarious means the bleeding usually where it used to occur. Instead of that, it is occurring from a different outlet. Let assume a vicarious menstruation. That means pervaginal bleeding during a menstrual period there must be, but instead of that, there is bleeding from nose or bleeding from mouth or ear or rectum, anything, and that is known as vicarious menstruation. Or in case of traumatic epistaxis, then let us assume a blow on your nose. Because of that, there is bleeding through your nose, and that is known as traumatic epistaxis. Arnica is one of the very good drug for any trauma. We can also be think of acetic acid. So if there is a hemorrhage, we can think of acetic acid. Now, hemorrhage followed by prostration, more we inclined towards acetic acid and cinchona. Second point says the same thing, the great prostration after any injuries, after any surgical shocks, or after anesthetics. That means after any injury or after any surgical shocks, there is a large amount of bleeding, that is hypovolemic shock. And because of that, patient is very prostrated now. Usually after a huge bleeding, patient, if under any blood transfusions, then patient can recover fast depending upon their ages. But in case of acetic acid patients, they are facing problems in recovery. They are facing problems even after blood transfusions or even after a slight amount of blood loss. Third point is the most important, the thirst. This intense burning insatiable, satiety is never met for large quantities of water in dropsy, in as you can see in diabetes, in chronic diarrhea, the most important but no thirst in fever. That means acetic acid patient have much thirst during all those diseases, which is normal because dropsy means a generalized edema where the requirement of fluid in our body increased. In diabetes, we have heard the term of polydipsia, and in diarrhea, obviously we are losing more electrolytes and water, so body needs more and more water. So that is why there is increase in thirst. These are all normal, these are the normal symptoms, these are the pathological symptoms of increasing thirst. Acetic acid do good in them, but also during hyperpyrexic stage our body wants water fluid. But if at that point our body do not have any kind of thirst, this is a peculiar symptoms, and that indicates acetic acid. The fever may be of hectic type. As you can see in fever, it is a hectic fever, skin dry and hot usually at the day, but drenching night sweats at night. Red spot on left cheek. If there is red spots on face, as you can also see in scarlet fever or any chickenpox and all such things. If drenching night sweats is there, patient usually used to be thirsty but now have no thirst, we can think of acetic acid. Next, the last general point is cannot sleep lying on back. Sensation of sinking in abdomen causing dyspnea. Rest better lying on belly. So, if a patient came with a presenting complaint of dyspnea, the patient says, I feels difficulty in breathing or shortness of breath throughout the day, but when I sleep on my back, it aggravates much. I feel very worse. Then you can think of acetic acid and ammonia too. But patient says if I sleep on my belly, then I feel little bit of amelioration, little bit of better. Then it is a case of acetic acid. But what if the patient says if I lie on back, my sensation of difficulty in breathing or shortness of breath decreases? It is a symptom of arsenic. So these are vice versa. We must remember. So till now, we have understood the acetic acid, four most important general symptoms, that is after any kind of injury or any kind of cross pathology, the patient have prostrations, the patient have wasting diseases, and that is why patient is very weak. Even the reason of this weakness or prostration may be injury, maybe surgical shock, maybe anesthesia, maybe other kind of hemorrhages, and because of all these, patients are very weak and prostrated. Those patients usually have higher amount of thirst, but if the presenting complaint is fever, then there is no thirst. Patient, if present the complaint about dyspnea, then patient have problems worse while lying on back. But while lying on belly, the problem gets decreased. Patient feel better. So these are the general symptoms we must remember in a case of chronic disease. So whenever we are trying to prescribe acetic acid, these symptoms are more important. Then now come to the particular case. As we also know that in chronic disease, Dr. J.T. Kent have suggested that we must give importance on mental general symptoms first, then physical general, then particular symptoms. But it is also noted that particular symptoms hold also the great amount of totality, so we cannot exclude the particular symptoms. So whenever you are going for a chronic case taking, do not take only the physical generals or only mental generals if there are any. Also includes and must includes the particular general too, or the particular symptoms too. Because with these three symptoms or three types of symptoms, there comes the totality. Okay. Next come to the particular symptoms of acetic acid. First is gastrointestinal system, and first is diarrhea. We have already discussed in diarrhea there is increased thirst. Patient is feeling very weak, as huge amount of blood loss. In chronic diarrhea, acetic acid is a good remedy. In dropsy, typhus, phthisis, there is TB with night sweats. Next come to the female reproductive system, that is the sour belching and vomiting of pregnancy, which is also known as hyperemesis gravidarum, which is a situations usually during the first trimester of pregnancy. Patient feels nauseating and vomiting, but if the symptom is worse day by day, then you can think of acidicum acidum, and if this condition is known as hyperemesis gravidarum. Burning, waterburst, profuse salivation, watery feeling inside mouth, day and night, constant this kind of nausea, problem, facing difficulties day-to-day activities, then we can think of acidicum acidum. Next come to the respiratory system, one of the very strong area where acidicum acidum works good, and that is the true croup. Croup we also known as the laryngotracheobronchoscopy, sorry, bronchitis. That means throughout the upper and lower respiratory tract, it has been affected. Acidicum acidum in dyspnea or in cough, croup kind of cough, is not prescribed at the first stage, where the disease get much worse, where the disease gets much in bad condition, then we think of acetic acid, because it has been stated that in last stage, Okay, when this is very, it is in worst stage, then you can think of acetic acid. With that kind of dyspnea on lying back aggravates, there is a true group and cough with inhalation. If you ask the patient to cough, the patient while going for inhalation, then it excites the cough. But if you find that after inhalation, when patient try to exhale, at that moment patient coughs, your drug of choice must be aconite. So during inhalation, spongia and acetic acid works. Good. So here you need to provide attention to the patient. Second point says inhalation of vapor of cider vinegar has been successfully used in croup and malignant diphtheria. So in malignant diphtheria or croup, inhalation of acetic acid works better, and this acetic acid is basically crude acetic acid. Now in homeopathy we used potentized remedy for better and faster recovery. As we also know, the potentization means bringing the inherent curative property of a drug. Okay. Lastly, I have already discussed about fever. Remember, no thirst in fever, though acetic acid patients have large quantity of thirst. And the last point, next, that is the relation. What the relation says, it antidotes anesthetic vapors, that is amyl nitrosomes, fume of charcoals and gas, that is carbovage, and opium and stramonium. Second is cider vinegar antidotes carbolic acid. Very important, cider vinegar antidotes carbolic acid also. It follows well after China in hemorrhage or any kind of blood loss, followed by weakness and prostration. You can think of Syncona and acetic acid too. After digitalis in dropsy, if there is a cardiac dropsy or generalized edema, you have given digitalis, but it after some time do not work much. You can think of acetic acid then. Now it aggravates the symptoms of arnica, belladonna, mostly the headache of belladonna, lachesis, and mercurius. So these are the drugs. If you prescribe, be cautious the prescription of acetic acid. So this was all about acetic acid. So to gist acetic acid, you must remember there must be a history of any kind of blood loss or wasting diseases or a gross pathological situation where the patient feels very weak and emaciated, and because of that, uh, acetic acid has a great prostrated acetic acid known as great prostrated remedy. Now the patient can provide symptoms or present symptoms like dyspnea, fever, or any kind of nausea, vomiting during pregnancy, or any respiratory illness. In that case, you remember in case of chronic disease or any diarrhea, think the chronic cases, the chronic symptoms of acetic acid. But if it's not the chronic, if it is an acute presentation, if it is a particular symptoms, focus on the acute case taking mostly. And this is all about acetic acid, not a big drug. I will try to uh, I will try to cover other books also and other authors what they say about acetic acid. So for today, this is uh, you read it. If you face any difficulties, let me know in the comment sections. Next day, we will try to bring another drug. Till then, have a good day. Thank you to all.